Welcome, everyone, to the Modern Day Overthinker podcast. My name is Colin, and I am your host. This week's episode is with Eileen Kopsaftis. She is a physical therapist with over 30 years of experience, and she focuses on pain management. She has a unique approach. We talk about her insights on the connection between mental and physical health, and also about how to have a strategy for managing those challenges, and the way anxiety and stress can impact physical health. Eileen is an author. She's written books around pain and aging, and we had a great conversation. She's a wealth of knowledge, and I love talking to her, and I could have talked to her for hours as usual. You know, I can be a talker. But this is episode 100, number 100. We made it this far, and I appreciate everyone for rocking with me, for riding with me, for however you want to say it, for being there to support something unique and something different. I hope you get something out of this episode. This is episode number 100 with Eileen Kopsaftis. Well, Eileen, I appreciate you joining me today. I want to welcome everyone to the Modern Day Overthinker podcast. And I am your host, Colin, and I have Eileen with me, and I'm going to have her give a quick intro here in a second. And I just wanted to say thank you for bearing with me on dealing with my scheduling and all that good stuff and being patient with me. I really appreciate that.
Well, stuff happens, and, getting overworked about stuff that isn't really all that big of a deal. I'd rather save my emotions for something that really needs it. So
That
I'm
is a
just
great
thankful we were able
perspective.
to
I
connect.
could talk.
So,
I could talk about that perspective for all day. I love
yes,
that.
yes.
So I
Well, at
appreciate
my
that.
age, I know we were talking about age. Don't let the little things, I stopped letting little things get to me a long time ago. So,
Yeah, because they build up, as we
yeah,
all know.
absolutely.
Well, before we get started, just for my audience, just to give them an introduction as to who you are, what you do, and what we kind of wanted to touch on today, and then we can kind of get into the conversation.
Okay, sounds good. So, I've been a PT for a little over 30 years, and I've been focused on getting people out of pain. Not the conventional way. My training is eclectic. It's a little different. I've always been different. When I was little, my mom used to tell me, "Why do you have to be different?" And I thought there was something wrong with that. When I got older, I realized it was actually a good thing. And so I don't practice the typical way that people do. And I also have a nutrition educator diploma because food does impact our overall health, even our mental health. Movement impacts our mental health. Everything's connected. And so the more I learn, the more I'm able to help people. And I love what I do. And I want to erase pain from the world. That's kind of my mantra.
That's your mantra. And you also have a couple books that you've written as well. I wanted to
Yes.
touch on that for anyone,
Mm-hmm.
any of my readers out there listening that want
Yes.
to give those
So my first book I
look.
wrote that came out in October of 2020 when the world was shut down.
Yeah,
And
fun
it was a
time.
great time to read. And that's called Pain Culprits. And the whole point of that book is teaching people the things that aren't mainstream knowledge about pain, but they should be. And so there's chapters in there about, if your knee hurts, it's probably not your knee, it's probably your hip or your ankle. I mean, I go into detail. Talk about meds that cause pain. I talk about treatments, benefits, risks, all those kind of things. So there's a lot in there about pain that is, again, not mainstream knowledge, but I really think it should be. And then my second book came out about 4 years later, and actually 2025. So just 4.5 years later. And that's aging culprits, because when people come to me for help, half of them want to get rid of pain. The other half don't want to end up in a nursing home like they've seen
Hmm.
their relatives, their friends, their family, loved ones. And there's a lot that can be done to work toward that end. Nobody ever set a goal to go to a nursing home. So, yeah. And I've worked in lots of different environments. I've worked in acute care and hospital settings. I've worked with people in ICU hooked up to more tubes than you could shake a stick at, to post-surgical. And I've done home care for a decade. I've done nursing home settings, long-term rehab, orthopedic outpatient. I've worked with teenage athletes. So I've worked in pediatrics, but I don't claim to know it all, but I do state that I've kind of feel like I've seen it all. And
Mm.
so, I've been able to make a lot of observations and connect a lot of dots that some people might have missed.
Yeah, absolutely. And before we got on the call, we were talking about how mental health can impact physical health, more importantly, pain. So I wanted to start by talking about that and get into some of your knowledge on that, because it seems like you have a wealth of knowledge in the subject, and also you have a lot of experience. So I wanted to touch on that and see just the correlation, because I've noticed that with myself and my journey, uh, dealing with my mental health, that I have a lot of issues. I'm just gonna just give you some examples of what I have going on, just because I'm very open on here. Um, so I experience a lot of pain, like lower back pain, tension, and I'm every chiropractor I've gone to says they can't help me because I fight back and I'm too tense. And I know that's pretty common with people with anxiety. And I've also heard, hey, you probably have issues with your pelvic floor. I heard that recently. So that one I'm still learning about. So I'm just trying to give you a couple ideas here to bounce off of to get started. But yeah, what would you say is something that you hear the most when it comes to correlation between mental and physical health and pain?
I think the biggest thing is when you're dealing with anxiety, your your brain is kind of stuck in the run from the bear mode. And I
Hmm.
mean, the scientific terms, and I'm sure you're familiar with these, and so is your audience, is the sympathetic nervous system overdrive that happens. And your body's getting ready to either fight or run or
Fight or flight.
freeze out of pain, out of fear. There's also another one called fawn. And what that is people who have a history of abuse trauma, who may have had to deal with an abuser and had to behave in a way that wouldn't elicit harm. And so that's
Mm,
called fawning. They would have to kind of pretend that everything was okay and try
yeah.
to say the right things and figure out what to do. So there's more than one, it's not just fight or flight. There are different responses. But you're still in that sympathetic mode. So when that happens, this chemical cascade occurs in the body. Cortisol is the stress hormone. I think it's glutathione, if my memory's serving me right, is essentially the fear hormone. So there's a lot of chemicals that get released, and those chemicals are there for a reason. They're there to get your body to be able to handle what needs to be handled. And unfortunately, they're not there to allow your body to be in a state that promotes healing and repair. So that's the parasympathetic nervous system response. And you can think of one like the brake and the other like the gas pedal. And we all know that when you're in a car, you don't use both pedals at the same time. It's one or the other.
Yep, absolutely. Yeah.
So, when you're in that sympathetic mode, you can't be in the parasympathetic. You basically have shut off your heal and repair mechanisms. So, and those chemicals are getting your muscles ready to do what they need to do. And so they're going to increase tension, anything that increases tension, wherever you may have an imbalance in your body, whether it was from a sports injury when you were a kid or you fell off your bike or whatever, there may be some imbalance going on in the body. And when that increased tension happens, those areas that have an imbalance are going to feel it more than others. So now
Yep.
it's going to create pain in those areas. And then there's also, the GI issues. And a lot of people aren't necessarily aware of this detail. When we digest our food, there's another nervous system called the enteric nervous system. And the enteric nervous system is essentially the gut brain. It runs the show. Your brain in your head doesn't run your digestion. You don't think about the fact that, what your food is doing from lunchtime today. But the interesting part is the enteric nervous system is part of the parasympathetic system. So it's part of the heal and repair. And so if you're stuck in the run from the bear mode, your digestion isn't really going to happen in any kind of a healthy way. So it's going to disrupt that whole process as well. So there's so much about it being in that mode. Now, there are a lot of strategies that you can use to help to get out of that mode, and more really brilliant people. And I always kind of joke and say, I'm not all that brilliant. I'm just really gifted at finding brilliant people and learning what they know. And
That's very important.
yes. And there are a lot of brilliant people out there that I wish I could be like when I grow up. And,
Yeah, me too.
and the thing about, the strategies, we've learned a lot about the vagus nerve, which is Latin for
Yep.
wandering. And it's because it's the longest nerve in the body, going from the neck down to all the organs. And it's essentially listening to the body, what's going on. And you can improve your vagal tone so that it helps to put you into that heal and repair mode, telling your body everything's okay, telling your central nervous system everything is okay. There's a lot of strategies that people have learned that can improve that. Simple things like cold water, splashing cold water on your face, humming, singing, breath. There's 3 specific breath strategies that I will teach for people who have chronic pain, just to get them out of that. Because even chronic pain can put you in that run from the bear mode, even if you don't suffer from any mental health issues. So you want to be able to address those things. And so there are a lot of great strategies that can work that. And you can even do movement. That there's a book written by Dr. John Rady called Spark. I read it many, many years ago, and he is a mental health expert, and he prescribes exercise to his patients because, and he talks a lot about it in the book, about how it will address depression, it will address anxiety in some very positive ways. So movement also, I teach movement all the time. I have an online academy and we do a live class every week. And I actually did a movement for putting yourself in a state of calm.
Mm-hmm.
And at the end of it, we did a 3D breath strategy. And everybody was like, okay, I feel like I could go take a nap now. They were very relaxed, but they did movement and yet they were relaxed. So there's a lot of really good things that people can learn to do.
Yeah, movement's very important. I've noticed that, especially as people get older. Like my grandma, for example, she was always doing something. She was always moving, and she lived to be 86. And it seemed like once she was not able to move around as much anymore, it was just a quick decline from there.
Mm-hmm.
And she knew that. She was a nurse, so she was a retired ER nurse, so she knew all that. And plus, she just didn't have it in her to sit still for that long period of time anyway. She was just a busybody, and that's the way she was. But it's definitely, and I've noticed that it's very important with me. If I'm just I work from home and I have a home office, and if I spend too much time in there sitting down in my office chair on my computer, I need to go do something and, get out of the house or, move around the house at least, because it'll put me in a bad spot And then it's not even just about productivity. It's just about the basic movement. I do like productivity helps, obviously, because you can feel good about yourself. Like, I got this done, I got this accomplished, and you feel better about it. But like just the movement itself. And I always am surprised, not always surprised. I'm less surprised than I used to be, but like going to the gym and like when I leave the gym, I'm like, why was this so difficult to get me here? And then once you leave, you're like, oh, I'm glad I did that.
Yes.
And
Yes.
yeah, I really respect that. Did you say he was a doctor or
Yeah. Yeah. He's a
that?
psychiatrist.
Yeah, and he would prescribe physical things to
Love
do.
it.
Yeah, it's yeah.
And he talked
My
all about,
therapist.
the brain-derived neurotrophic factor. I mean, he gave all the chemicals, he gave all
Yeah,
the details in the
yeah,
book. He
yeah.
backed it all up with science and
No,
all, but he observed with his patients, and that's what I tell people. If you're going to listen to somebody who gives you advice, find out how long they've been doing it and how many people have they helped. Because there's a lot of
mhm.
people out there who have a lot of theory in their talk and their suggestions, but they may not know how it applies practically in real lives. And this doctor knew, he observed this, he saw this. So yeah.
Yeah, he was able to say he was able to walk the walk, talk the talk, all that good stuff, and yeah, back up is everything. Because yeah, it's definitely important. Yeah, my therapist will actually randomly tell me to go do push-ups.
Mm-hmm.
eh, Not necessarily just like for the movement, but to distract myself from overthinking and overanalyzing something because I have OCD, so I have it's just a lot going on. And so she'll be like, go do 20 push-ups, and because you won't be able to focus on what you're focusing on, and then try to get back into what you actually want to focus on. And it is a good idea. And yeah, also breath work, things like that. I've done all of that. And yeah, there's a lot of stuff out there that can help. And then yeah, you touched on the gut brain communication. I have a lot of experience with that. I've had issues with that probably since I was like 20, and back and forth. I've gone to gastros, gone to all that good stuff, and they're always like, you need more fiber, you need more take some Miralax and da 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 da. I'm just like, uh there is no, like, if your body is super I've learned this from my own body. If your body is so tense and so like just like stuck, it's there's it's gonna take a lot of fiber and medication to get things going, if that makes sense.
Well, if
Because
I could offer some
yeah,
information on that topic,
yeah, absolutely.
um, there are things that are the basics. You do need to make sure that you're eating whole plant foods, that you're getting fiber. You do
Yeah,
need to make sure you're drinking enough water.
it's
A lot of
part of it.
people are just dehydrated, they get constipated. They're not eating any
Yes.
fiber, they get constipated.
Yep.
It's that joke when you see somebody who's grumpy, you want to ask them, have you got fiber? You know. Uh,
Yeah,
And there's
true.
also movement. People who aren't moving, the digestive tract can just kind of stall. But there's something called peristalsis, which is the active movement that happens in your digestive tract. So like when you swallow food, there's this muscular action that happens that moves the food along from the time you swallow it until the time it ends up exiting your body, the parts that you don't need, the undigestible fibers and that kind of thing. Now, peristalsis can be impacted by that chemical cascade. Because, as I said, if you're in the run from the bear mode, your body's not going to be concerned about digesting food. So sometimes it'll be the opposite, where people have heard about they were so scared they pooped their pants, or they were so scared they peed their pants. It's because the body said, let's dump it all so we can
Yeah.
survive this
Yeah.
scary event. But there's also the opposite, where, like you said, if the body's under so much tension, things just can't move. I actually teach, I teach some classes on urinary incontinence as well. And I know you had mentioned the pelvic floor earlier. Um, there's, there's a lot that can be done to improve the function of the pelvic floor. I've worked with a lot of people who've had pelvic pain and incontinence and not being able to completely empty their bladder, that kind of thing.
Mm-hmm.
And there is a lot that can be done to improve that area. It depends. You've got to figure out what's going on. If it's just the fact that the muscles have weakened because so many people are sitting prolonged, like you said, you're in your office, you're on the phone, the computer. That's a lot of sitting.
Need
And
to get that standing desk. I keep talking about it, but I
yeah,
haven't got any.
well, I'm at my standing desk right now, and it can go up and down,
Nice.
so I love it.
Perfect.
But the thing is, but if you stand in one spot forever, you might end up with pain someplace
True.
else. So because the body's designed to move, so you got to kind of be able to go back and forth and move.
Yeah.
Like go to the printer or go get water, whatever. But
I
the
have a lot
thing,
of friends. Sorry, I didn't mean to interrupt you.
no, that's okay.
I have a lot of friends that have a walking pad
Okay,
under their desk.
yes. I've been
And
doing some research. I've been thinking of getting one of those because I do a lot of content creation and I am on my computer
yeah.
and I do want to, although I tend to do my 3-plane motion while I'm standing here and just get moving. So
Just a random question. How do you feel about, I forgot what they're called, like the shake pads that like shake your body?
the vibration,
Yeah.
yes.
I always wonder if that's really like a gimmick or what the deal
Yeah.
is with that.
Because some of those are real expensive. I mean, you can spend thousands of
Yes.
dollars.
Yes.
Yeah, and I did a deep dive into the research on it because I was hosting an event. I do a lot of live online events that are free for people to come to. And one of them, I wanted to really see what the latest research was on bone density because women are very concerned about losing bone density and that risk of fracture and all of that. And a lot of what we're told and even kind of like intimidated from some well-meaning but kind of misinformed healthcare professionals isn't really accurate. But the bottom line for this is the vibration plates are kind of touted as improving bone density. And the data doesn't really support that. It's kind of, the jury's still out. So my thought is if you can't really confirm something's really going to work, why would you want to spend all that money on it? There
Yeah.
are a lot of things that work really well for improving bone density that don't cost a penny, like just standing and then lifting your heels and dropping them on the floor and creating that vibration just from doing that. That's free. Didn't cost me a penny. So,
Yeah.
and I know it works because the data proves it. So there's a lot of things you can do. But the pelvic floor, there's movements you can do. I teach people like in the UI class, if they're struggling to empty their bladder or feel slightly constipated, you can actually do 3-plane motion with your pelvis while you're seated on the commode. And sometimes that really helps to get things moving. And that 3-plane function is kind of like where you round out your back and you arch your back. So that's the one plane of motion. And the other is where you sort of shift your weight from one cheek to the other cheek. You're not actually lifting, but you're kind of shifting. So that's that other plane of motion. And the third one is rotation, where you're just kind of twisting. And doing those 3 planes sometimes can really help people if they're struggling in that area. So it's just one little tip that might help somebody.
Yeah, because everybody talks about IBS, and they're like, IBS, there's 2 types of IBS. There's IBS-C, and then there's IBS-D. So I have IBS-C, and I know that a lot of the stuff with anxiety and all that stuff plays a huge factor in that. And also, lack of movement, sitting too long.
And
There's just,
certain foods can really trigger. I had a colleague who shared with me that she was really struggling with IBS, and I went over her food intake, and she was consuming a lot of dairy. And I told her, I said, you might be one of those people where dairy just is not your friend. And she eliminated dairy reluctantly, but she eliminated it. And I think
it's
it wasn't
tough.
even 3 days later, she said, IBS, my foot. She didn't have it. It was her body responding to the dairy. So So sometimes it could be, a low-hanging fruit, and we need to go
Yeah,
after those
elimination
fruit.
diet type of thing, like
Yeah,
eliminating
yeah. But
something.
certain foods really are known to be triggers of that, and dairy is a huge one.
For both constipation and so either or?
Well, you gotta, if that's a trigger for you, no matter what's going on, it's worth investigating. And I don't know that they've done any clinical studies, what type of IBS you have. Is dairy an issue? I
Yeah.
think I've just seen it be an issue with a lot of people, joint
I've heard
pain,
that too.
all kinds
Yeah.
of things. So it's worth trying because it's a very simple thing to just eliminate that for a few days and see if you feel better.
Yeah,
So,
that is true. Yeah, and then they're like, "Yeah, you need to eliminate stress." I'm like, "I don't know if I can eliminate stress.
yeah,
I can
yeah.
handle it better,
It's the
but yeah,
response to it. Yes.
the response to it is where it's at." Yeah.
Hmm.
Um, so yeah, as far as yeah, we kind of on a tangent there a little bit, but I did want to touch on some of the techniques that you use. Like you said, you coach people, you do sessions online. What are some of the most common things that you're seeing lately that people are coming like, I really need your help because of so and so? Is there like something that's like really, really
Yeah. So, well, half the people who come to me want to get rid of pain. The other half
okay?
want to age without decline. So,
Okay.
and it really is kind of like a 50-50 split. I did a survey
50,
a few years ago.
okay.
So if we're going to focus on the pain piece,
Yeah.
um,
We'll start there.
I think, I think probably the most common thing I hear is, I've tried everything, nothing
Mhm.
works. It just keeps getting worse. And it doesn't even really matter what body part it is, whether it's their shoulder, their hip, their knee, their neck, their back. And what I have found, the biggest reason, the number one reason that the pain isn't going away is because the cause isn't being addressed. And I know that sounds like kind of okay, that's just sort of a silly trick answer. But so often when somebody goes to seek help for pain, they're
Mhm.
seen as a body part. They're not seen as a whole person.
Mm.
And everything's connected anatomically. Everything, that old, this bone's connected to that bone.
Yeah.
It's very true when it comes to how the body functions. And if somebody has, say, chronic shoulder pain, and the number one thing that everybody will say is, oh, it must be your rotator cuff. And everybody's going to get the TheraBand out. They're going to start, doing this, keeping their elbows in by their side and pulling their hands out. The rotator cuff is kind of considered the culprit when it comes to shoulder pain, but it's not accurate because what I've observed is looking through data and working with people for over 30 years, the shoulder depends on other parts of the body to function correctly.
Mhm.
And when those other parts of the body aren't functioning correctly, the shoulder is not going to move right. And so when you're using it, it's going to irritate and inflame and annoy tissues. And so what I've observed is the rotator cuff problem that might show up on imaging, if they happen to get an MRI or whatever, is really a result of something causing it. It's not just because the shoulder got worn out or overused and so we have to figure out, okay, what caused it? If you just have surgery to fix the rotator cuff, but you don't go after the cause, those people are the people who they don't even really recover well from the surgery. And now talk about dealing with some mental health issues, serious depression. It takes like a year to recover from a shoulder surgery to be able to get back to really doing lots of good stuff with your life. And I mean,
So
that can be
here.
really
Yeah.
depressing and anxiety inducing for sure, because you can't even sleep on your side. You can't,
Yeah.
use the toilet and wipe
Stressful.
yourself. I mean, is it your dominant hand, your non-dominant hand? It really impacts your life. So the thing with the shoulder, as I said, it depends on the entire body functioning right. And I know that sounds a little overdramatic, but it's true. You got 18 muscles that directly impact the function of the shoulder. Only 4 of them are the rotator cuff. And the rotator cuff's job is to keep the joint stable. They have nothing to do with strength, pushing, pulling, lifting. That's all the other muscles. And that joint is, or those joints, because you've got a lot of joints in your shoulder, those joints are depending on the rest of the body to do their part. It's a team effort. And so I'll just give a couple of simple examples. Say you want to push something up overhead and put it in the compartment on the airplane. And say when you do that, you get some shoulder pain. Well, it could be because you've been sitting on your backside for 10 years or 8 hours a day for 5 years. And your power source, which is max, gluteus maximus, I call max the power source, your power source could be weak and not working properly. So if I go to put something up overhead, it's not my shoulders doing 100% of the work. I'm going to squat down because I know it's a little heavy. So I'm going to squat down to kind of load those muscles. I'm loading my back hip. I'm loading my quads, but mainly back hip, a little bit of the calf muscles, the ankles. And then when I go to put that overhead, I'm going to push through my feet with the same amount of force that's required to lift that weight, because it's a physics thing. For every action, an equal and opposite reaction is required. I'm pushing through my feet to get that up overhead. I'm not counting on just my shoulders to do it. So what if I've got issues in my hips? What if I've got issues in my legs? There's a lot of weakness there, or there's an imbalance. One side maybe got injured a while ago and it's not really working right. So you kind of do this funky sort of twist and side bend thing. So one shoulder isn't getting the help it's supposed to get. And it's saying, hey, what's happening down there? So And then, I mean, I could tell one quick story. Football quarterback who had got a diagnosis of shoulder tendonitis when he was doing his practice throws. And he came into the office. He had nothing wrong with that shoulder. It was perfect. There was no issue with strength or range of motion or anything. And so I asked him to show me how he threw a football because he couldn't do his practices. He had pain and had to stop. And his ankle was so unstable when he threw that football. I said, how long has your ankle been like that? And he said, well, I roll it over in practice and I have to walk off the pain. Now, he shouldn't be working as a quarterback with an unstable ankle, but that's a whole nother topic. And so we worked 3 or 4 sessions to teach him how to get that ankle stable. And he had no more shoulder pain. He could do 3-hour, 3-man throws, no shoulder pain whatsoever. I never touched his shoulder. So, but if he had been seen as a shoulder joint that walked through the door and I didn't know the connection, he would not have been helped. So he would have been somebody who every time he went to release that ball and that ankle was unstable, the arm was doing excess movement because the ankle wasn't stabilizing his movement. That eventually he would have ended up with injury to that shoulder. But the shoulder wasn't the culprit. It was the victim.
Yeah, that makes a lot of sense.
So there's so many body parts that have other areas that are the culprits, which is why I wrote my book, Pain Culprits, so people can learn that. The knee is counting on the ankle below, the hip above. So many people have a history of ankle sprains or ankle when it wasn't functioning for a while. Maybe they had a surgery, an injury, whatever. The knee is not going to be happy if that ankle's not functioning right. And very few clinicians will look at someone as a whole body when they walk in the door and figure out where's the culprit. They're just going to treat the victim. They're going to ice it, massage it, heat it, inject it, medicate it, surgically alter it. And they're not going to look for the cause because they just assume where the pain is the problem.
Which is part of the problem.
Right. And that can put a lot of people into depression and anxiety because you're dealing with chronic pain. I cannot tell you how many people have come to me
frustration with providers and finding the right provider.
Yes, because they're being looked at like they're crazy, especially if nothing shows up on imaging. No. And so, and then when they come in and I tell them what's wrong and they're like, oh my gosh, thank you. I thought I was going crazy. Everybody was looking at me like I was nuts. Nobody would believe me, that kind of thing. So yeah, it can be very anxiety inducing to have a pain issue that nobody knows how to fix and you're trying to deal with it. and get lost in the sauce. Yeah.
Yeah, and it could depend on where your area and the providers you have in your area and all that good stuff. So,
And then the
yeah, I
PT
know.
will say, "Oh, you're here for your back. I can't look at your ankle. I can't." And that's a whole nother topic that I won't get off on, but the therapist doesn't have their hands tied. It's not that they can't work a different body part. Some of it has to do with insurance reimbursement. Some of it has to do with how it's documented. But it's, yeah.
Yeah, I could talk about insurance for a while.
Yes, I could
Uh,
too, because I've battled
yeah,
them for people many years. Yes.
many years. Yeah.
Hmm.
So, yeah, it's like, whose side are they really on?
Workers'
Uh,
compensation is not on the side of the person. Absolutely not.
yeah,
Absolutely not. Workers' compensation is the worst, at least in my state.
yeah.
Um,
I
yeah,
mean,
yeah. And Medicare, here's the interesting thing. Medicare um, really ties the hands of people working with people who have Medicare because they review the charts. And if, say, somebody comes in and the prescription says low back and, or say shoulder, and you're looking at low back, knowing there's something going on with low back causing the shoulder problem, if you document that you treated their back, you won't get paid for that session. So this is why a lot of times clinicians will say, "Oh, I can't look at your back. You're here for your shoulder." Now, if you know what you're doing, you can be completely honest and transparent in your documentation, but you just use anatomy because you've got muscles that go from the shoulder to the low back.
use the
And when you're
science.
treating the low back, you're treating those muscles. So you just name the muscle and just say distal insertion or something like that. So it doesn't mean you can't help the person. You just have to learn how to document accurately and defend it. I've defended some work that I've done with people who had Medicare because they needed the PT and I wasn't going to let them get shafted because of insurance. So,
Yeah,
yeah.
that's good. It's good to have providers like that because there's so many that are just, or if they're part of a practice, you push it off on somebody else and somebody else
Hmm.
has to take care of it. And then I saw I actually shared it on my Instagram, a video of like this guy going to see a psychiatrist and they're like, yeah, well, I know we just started, but we're almost out of time. And like just exaggerating everything, but it was really funny because it's funny but sad that how true it was,
Yeah.
and they're just trying to get people in and out, and
Hmm. And in my
that
profession too, they're forced sometimes to see 3-4 people in an hour. How can you help somebody in 15 minutes? You can't, especially with all the documentation that you have to do. So I stopped working with insurance years ago. But what I love about the fact is I can spend as long as I want with somebody. And if they don't have resources, I can be as generous as I want. I mean, I'm not tied to all those rules and regulations. My goal is to help people. So,
yeah, yeah. I don't think I could deal with all the regulations and stuff because yeah, I'm thinking about going back to school to be a mental health therapist and counselor, however you want to label it. There's a bunch of acronyms for that too.
yes, there are.
Um, but yeah, my thing is like I didn't want to go through going to the doctorate level and being a psychiatrist because I don't want to deal with all the med stuff. Like that,
Yeah. Yeah.
it's just, and then,
And
yeah,
unfortunately, most psychiatrists, that's all they're doing now is prescribing. Yeah. Yeah. My very favorite psychiatrist on the planet, and he's written tons of books, is Dr. Peter Breggin. I don't know if you've heard of him.
maybe if I saw him,
Yeah,
I'm good
he's
with
got
faces.
quite a few videos on YouTube as well, but he is expert at working with people. He's never medicated a patient. He's been a psychiatrist for like 60 years. And his expertise is to get people off the meds and and counsel them and bring them to a healthy state. And he's just amazing. I think he might have hit 90 by now. And he's still working part-time because he is so good and loves his profession so much. But
Yeah.
he just oozes love. When you're in the room with him, you're like, you just
Yeah.
love him. And
Yeah.
you can see how he would be amazing. He practices what's called empathic therapy. And
Okay.
he's wonderful. So there's a lot of good psychiatrists out there, but unfortunately, many of them do practice more the medical model and don't really.
Yeah. I mean, there's a time and a place for medication. But that being like the first thing and the only option, it's just like we all are getting smarter than that, and we
Yes.
understand because yeah, it's as somebody who's been on medication most of my life, I have been dealing with, one psychiatrist says this, one psychiatrist says that, and then I think I finally found one that's not like treating me like a number too.
Which
That's
is
another thing.
wonderful. Yes.
Uh, because I had a situation with I'll try not to vent about this too much, but I had a situation with a psychiatrist recently who was I basically called him my drug dealer um because he's a legal drug dealer, and that's basically what he was doing. Is I'd have to, make an appointment, and it was usually like 3 months in advance, and then I got to the appointment or got time to almost be at the appointment. They called me. They said, "We're gonna have to reschedule. The doctor can't be there for that day." And this last time it happened, it was in November.
Mhm.
This happened twice, and they're like, "So what are you looking like? What does your February look like?" I'm like, "Are you serious? Like, what do you want me to do?" And so yeah, I luckily I was in the process of changing providers because this had already happened one other time,
Mhm.
and I didn't feel comfortable with the process because I felt like it was very rushed. Every time I went in there, it was like, "What? This, that, da, 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 check a couple boxes, get out of here." And they make more money that way, which is weird. And like the less time they see somebody, depending on how it's coded, it's like the whole thing. Yeah, it's unfortunate. I found somebody that's like, when you're talking about treating the cause or the main pain point, I found a psychiatrist that actually specializes in obsessive disorders and OCD. And usually you can find therapists like that, but finding a psychiatrist that specializes in specific disorders and things like that is
Mhm.
not as easy to find. And I
Mhm.
had to go out of my way, 3 hours out of my way, uh, to see this person in person. I can see them virtually now, but I had to see them in person for the first time, which was fine. And they were very thorough. I was there for a couple hours. Like, they took their time, like, asked all the questions, and it was great. And that's how it should be. But
Yes.
unfortunately, there's a lot of just like that, like well, it's unfortunately the hospitals and some of the providers, they're businesses.
Mhm.
They're it's not a healthcare. It's not healthcare. It's a health business
Right.
model.
Healthcare is a business. I mean, it
Healthcare is a business. Yeah, I
is a
mean,
business. Absolutely.
it is. Whether it should be is a debate.
Yes. That's a whole nother topic.
uh, that's
Yeah.
a whole nother topic. But the more I've been in working in health insurance every day, with employee benefits, I've noticed so many different things. That's like, there's so many things wrong. And then as being a patient, also notice there's just so many things wrong. And also you have to not be afraid to switch providers if you don't feel comfortable, if you're not getting the information you're getting, if you feel like you're not being treated like a patient and you're just being treated like a number, because you are the one that you're the customer.
Well, and I
And
tell
that's,
people all the time, if you're being treated for pain, if they haven't shown, if you don't see any benefit from what they're doing after 3 or 4 sessions, you need to find someone else. Because
yeah,
I mean, I'm not saying you should become 100% resolved in 3 or 4 sessions, but if you're not seeing improvement by then, what they're doing isn't working. So they either need to change what they're doing or you've got to find somebody else. Absolutely. Yeah. And a lot of people don't realize that you can actually say no to a healthcare provider. You do have the right. I had somebody tell me once, until I met you and heard you talk, I didn't think I could tell a doctor no. And that kind of
what?
scared me because
That is
he
scary.
was in his 30s. I'm like, what do you mean? You didn't think you could tell a doctor no? And it was kind of crazy. I think what he meant was, the doctor's the one who knows it all. You don't know anything. So why would you say no? You should say yes to but there's a reason that's called a medical opinion, and you can go to 3 of them and get 3 different opinions. So I tell people, you don't have to be a medical expert or an expert on pain. The $1 million question to ask is, how much will this help me? And what are my risks?
Mm-hmm.
And most people don't ask that question. They don't even know to ask that question, whether it's a medication, a procedure, a surgery, a treatment. I saw a lot of people in the clinic setting who said, man, I wish what I knew back then, what I know now, because I would have never agreed to this. If I had known what my risks were, I probably wouldn't have said yes to this. So that's important. Yes. Yes.
It's definitely good to ask questions and to, get opinions. And not you're not going to go to one appointment and the doctor, like, you could, I mean, and the doctor's going to be like, yep, that's it. This is the solution and you're good to go. Yeah, maybe for like a cold
Yeah.
or something, but
But
like,
usually let's try this. Let's try that.
let's try
If this
this, let's
does,
try
let's see
that.
how you respond. If
And
this
then
doesn't
you could
work.
say, I don't want to try that.
Exactly.
And I've learned that too. Like, cause you think like, oh, they're the expert, I should listen to them. It's like, well, if you don't feel comfortable with it, like, I'm trying to think of an example. I did that recently where I was like, no, we're not going to do that. Oh, yeah, I had an issue with, I'm not going to get too specific because it's kind of personal, but I had some pain issues, and the doctor was like, okay, I think it's an infection. I'm gonna give you some antibiotics. And that was the first time I went, so I was like, okay, whatever. I'll take the antibiotics.
Which messed
I
with your
did not.
GI tract, by the way.
Yep. And which made me more anxious, which made, my mental health spiral. But I still went through it. I took all of them like you're supposed to. And then when I went back, I thought the pain had went away, and it kind of did. And I kind of came back with like stress and things like that. And went back in there, and he's like, okay, well, we can try another antibiotic. And I'm like, no. Like, we're not doing antibiotics. Like,
Right.
I'm
You don't
not
even
going
know if
through
it's an
that again.
infection, really. There's been no test to prove it. And
Yeah. Like, yeah. It was just like, but he was like, okay. Like, he didn't like try to argue with me or anything. He was just like, yeah, all right. And then we shifted gears. Like, you could tell them politely to F off, or, I don't want to do this, or, I don't want a flu shot. When they offer you a flu shot, you don't have to take the flu shot. You can if you want to. It's up to you.
it's the same with PT. I remember I worked I had a patient who was kind of a high profile political figure, and we're talking, 20 plus years ago. And he had to go to Washington because they were going to be in session for 3 weeks. And he was doing much better. He had a serious shoulder issue, and he was doing much better. He had had surgery. I didn't see him until after the surgery. And he had been so, I want to use the word harmed by other PTs, that he was so scared when he laid on the treatment table. He was like beet red. He was sweating like crazy.
Yeah.
I mean, he was so scared. And I did a really gentle treatment that just calmed down his nervous system. And he was like, okay, I think I can trust this person. She didn't hurt me,
Yeah.
And
Yeah.
so he got very used to being treated without adding to the problem and saw great progress. And so he was going to go to Washington. He kind of joked and he goes, well, can I bring you with me? I'm going to be gone for 3 weeks. I said, well, my husband might miss me. But I told him, I said, because there was a PT in Congress that they could go to when they're in session, they have access to different healthcare.
Yeah.
And it was that PT, I think, that injured his shoulder because he shared with me something that had happened prior to the surgery. And I said, well, if you're going to go see that person, if he starts to do anything that hurts you, just say thank you, but no thank you, and walk away. And so he came back after the 3 weeks at session, and he came into the clinic, and he lifted his arm straight up and said, I'm doing great. He goes, and I left. I told him no thank you. But he had to be given permission to say no to that person. Because people think they have to subject themselves to, the so-called expert. It's sad. And I'm not saying that to judge him or be.
It's kind of like it's just kind of like what we just, I've always thought, like, that's kind of like how we feel like about doctors. Like, they're the experts, we should listen to them. And
right.
which is,
or any healthcare
I
person.
mean, relatively true, like, but they're still human beings. They're not robots.
Yes.
They don't
and they
know
may
everything.
not know everything about you. I worked in a hospital for years, and I would look through the charts, and the charts were sometimes really thick with the patients that I would go in to see after surgery or procedure or whatever. I wanted to know about them. I wanted to know what their history was because I didn't want to do anything that could potentially harm them. There's no way that a physician can sit and read through the chart of every single patient he's going to visit in the hospital for those first couple hours before he goes and does his appointments at his office. So there's things they could miss because, yes, they might be a medical expert, but they're not necessarily an expert on you. And you are an expert on you. So.
Yeah, you know more than you think you do.
Yes.
That's very true. Well, that's a good stopping point because we could continue going on a tangent there, and we could talk about how bad health insurance is. And but I really appreciate you taking the time. Before we get wrap things up, though, where can people find you if they want to get more information or look into your content and all that good stuff?
Yeah. So if they're really concerned about pain issues and learning more about how everything's connected and how to start assessing their body and training their body, I've got it's only like a 23-minute video on my one website where they can walk themselves through that 3-plane movement and see, oh, my knee hurts probably because that hip's not working right or that ankle's not working right. So it kind of shows them where the culprits are potentially sitting in their body, and they don't keep beating up the victim, and they can actually get some resolution because we want to resolve pain. We don't want to manage it. And so that is a website that I created where there is a free level membership where they can do a lot of great stuff and really help them without investing. And then, of course, if they like it, there is a paid level. But I call it Move Without Pain Private Club, but the link is mwpprivateclub.com. And all the free stuff is there. I'm also on YouTube if they put my name in. I've got a lot of movement classes on there. I talk a lot about the connections and the different things. I even have one that says, "Are you training like a dead person?" Because most of the movement industry is still having people do exercises based on studying what a cadaver and how the muscles attach, and that's not how the body functions in the context of real life. So a lot of people are
Yeah.
exercising based on knowing what a dead person does, or doesn't
Uh,
do. So that's why I kind of tease, "Are you training like a dead person?" So yeah, there's a lot of information on there. And then of course my books, the book Pain Culprits, I've got a website, just painculprits.com, and there's tons of resources on there. You don't even have to buy the book to at least access the resources. So lots of good stuff that can help people and kind of hopefully get them on the right track. So
yeah.